Hello, future doctors. How are you all? Welcome back to MedSteps YouTube channel. Myself, I'm Dr. Anand Jana, final year medical student. Today we are starting a brand new ECG series from the absolute basics. Many students are afraid of ECG because they think it's complicated. But trust me, if you understand the basics properly, ECG becomes one of the easiest and most interesting topics in whole medicine. So in today's lecture, we will learn what is an ECG, why do we perform an ECG, how does an ECG work, and that lead placements and basics. And without time waste, let's begin. So, what is an ECG? So, ECG stands for electrocardiogram. ECG stands for electrocardiogram, and this electro means electricity, cardio means heart, and gram means recording. Okay, so this ECG is simply a recording of the electrical activity of the heart. Think of the heart as an electrical pump. Before the heart contracts and pumps blood, an electrical signal travels through the heart muscles. You can see here. So then it will make this type of PQRST waves. Okay, P means atrial depolarization, QRS means ventricular depolarization, T means ventricular repolarization. Okay, we will discuss that thing in deep in our upcoming videos. So think of the heart as an electrical pump. Before the heart contracts and it pumps blood, an electrical signal travels through the heart muscle and the ECG records this electrical signals. Okay. For example, you can see this picture. You can think like imagine you switch on a light bulb. Okay. Before the bulb glows, electricity must pass. So the electricity coming from this wire. Okay. So the electricity must pass through the wire. Similarly, before the heart pumps blood, electricity must travel through the heart. So same to same, ECG records that electricity activity. Very simple. Okay. So these are the what is an ECG. Now, why we have to do ECG? So why do we have to perform an ECG means doctors mostly use ECG to detect heart attacks like myocardial infarctions and arrhythmias and heart blocks and electrolyte abnormalities. Okay, and enlargement of heart chambers and some drug effects. So because of some drugs, also some patients can get ECG changes. So whenever a patient has chest pain, palpitations and dizziness and syncope or shortness of breath, ECG is often one of the first investigation performed. Okay, so how does this ECG will work? So you can see here the heart has its own electrical system. Okay, you can see here this is the own electrical system passing whole heart. So here the electrical impulse starts from the SA node. So this is the main first node we call in right atrium. You can see that node we call SA node. Okay, this sinoatrial node is a natural pacemaker of the heart. The impulses then travels first SA node, then after it will travels to atrial, then after it will travels to AV node, then after bundle of peace, then after right and left bundle branches and Purkinje fibers and ventricles. You can see this image. First, the I'm marking with the green marker. So first it will start in this SA node in right atrium, then after it will pass to atrium, then after AV node you can see here in between. Then after AV node 2, we can see bundle of peace. Then after we can see Purkinje fibers. Okay, like this before Purkinje fibers, you can see left and right bundle branches. Then after Purkinje fibers, then after whole ventricles, the current will pass. So the electrical activity is detected by the electrodes placed on the skin. The ECG machine records the signals and produces waves on paper or screen. Okay, so what is a lead? So mostly in clinical rotation, accident emergency department, the doctor will tell like we have to place the lead, but we don't know where we have to place. So that's why I'm making very easy video to understand this ECG. So what is a lead? Many students confuse with electrodes and leads. Remember, this electrodes. Electrodes means the physical sticker attached to the body. That is electrode. Lead means the electrical. It will show the electrical view of the heart. Think of a lead as a like camera angle. You can see here. This is the football stadium. So think like that lead as a camera angle. Just as a football match is recorded from different camera angles, the heart is viewed from different angles using ECG leads. Okay, so same to same with this leads, we can easily view the heart in different views. Okay, so this is the main concept. So in standard, we have total 12 lead ECG. A normal ECG has 12 leads. These 12 leads provide 12 different views of the heart. So we have limb leads and chest leads. In limb leads, we can see lead 1, lead 2, lead 3, AVR, AVL, AVF, total 6 you can see. In chest leads, V2, V6, total 6 leads we can see here. So next we can see here that is limb electrode placement. So for example, sometimes the doctor will tell like we have to place ECG on the patient. That we have to always remember where which lead electrode we have to place. So that's why we have to know the color. So here we have some color. This is right hand. So this is right arm. This is left arm. So always the arm have white lead. The left arm will denote like LA, and the left arm we can see black lead. Okay, a common memory trick I will tell. So white on right arm, smoke over fire, black above red, and left atrium above and left leg. Left arm above left leg. So green on right leg. So for example, a common trick will be like white on right side, right arm. So white, if you're using white electrode, we have to use on which side? Right arm we have to use. Okay. If you're using black one, we have to use left arm and above the red means the left leg we have to place red electrode. Okay, so these are the things. Next one, we have just lead placements. So this is very important. If you are keeping any placement, if you are keeping any wrong placement, you are not going to get a proper reading. Okay, so we have this just lead placement, right? Total V1, V2, V3, V4, V5, V6. So first one V1, where we have to keep V1 will be like fourth intercostal space in right sternal border. Next one V2. V2 will be like fourth intercostal space and left sternal border. Next one V3. V3 you can be seen in midway between V2 and V4. Next we can see V4 that is fifth intercostal space and mid clavicular line. Next we can see V5 that is anterior axillary line and same horizontal level. So you can see here this is V5. And V6 will be like mid axillary line and some horizontal level as V4 and V5. Okay, so V6. So this is the just lead placements. Now the quick memory trick. So first of all, V1 and V2 mostly you can see in fourth intercostal space and get standard. This is the first one. The V4 will be like fifth intercostal. The V4 will be like you can see fifth intercostal space mid clavicular line. Okay. The V3 we can see between V2 and V4. And V5 we can see in anterior axillary line. And V6 we can see in mid axillary line. Why is which lead placement is important? Because the wrong lead placement can cause false diagnosis of myocardial infarction and false axis deviation. We will discuss what it means. The axis deviation, everything. Like when we are going to D4 or D6, that time we can discuss about this axis deviation, everything. Next, we can see abnormal ECG appearance and misdiagnosis of arrhythmias. So therefore, always place leads correctly. So in exam point of view, In exam point of view, what is the natural pacemaker of the heart? The doctor can ask, so we have to take essay note. In clinical questions, which chest lead is placed in the fifth intercostal space at the mid-clavicular line? That answer will be like V4. Next, in summary, what are the things we learned today? I'm making very short and simple videos for ECG because if you're making like series, easily you can understand and easily you can learn and you can watch more time, so you will get one idea. Okay, so these are the things. So next you can see here. Thus, in summary, today we learned about ECG means electrocardiogram, and ECG records electrical activity of the heart, and heart impulse starts from HA node, and you can see ECG has 12 leads, and you can see limb leads like 1, 2, 3, and AVR, AVL, and AVF, and chest leads will be like V1 to V6, and the correct lead placement is essential. So, in conclusion, in the next video, we will learn about the P wave, what it represents, and why it's important in ECG interpretation. If this lecture is helped you, like, share, and subscribe to the MedSteps YouTube channel. So, I'm signing off. We will meet in our next ECG lesson. Till the time, take care. Bye bye.